Welcome everybody to the meeting today. We're talking about Oscar, and he is an overweight male. He's 58 years old. He's got diabetes and uncontrolled hypertension. He was in a car accident 4 days ago, and he's been here in the acute hospital since then. He's got a broken right wrist and a broken left ankle, and they've both been casted. We're thinking about transferring him to a rehab facility, so that's what we're going to talk about today. And this is Penelope, Oscar's wife. Why don't you all introduce yourselves to her?
Hello everyone, it's a pleasure to be here.
Hello Penelope, I'm Brittany. I am Oscar's physician.
Great, Penelope, it's great to meet you. My name is Nikki, I'm the physical therapist.
Hi lads, I'm Meg, I'm Oscar's RN.
I'm Brittany, and I'm Oscar's occupational therapist.
I'm Oscar's dietitian, Brielle. Nice to meet you.
Nice to meet all of you.
All right, so Penelope, do you have anything for us to talk about today? Any concerns you have?
Yes, I have a few concerns. I'm concerned about my husband coming home to our house. I know he's supposed to be using crutches, but I'm not sure how he's going to do that with his broken wrist. And also, our bedroom and the loo are on the upstairs floor, and I'm not strong enough to help him get up the steps by himself if he's not on the crutches. And I don't think he can maneuver through our house for anything else. Are there any other options for him besides going home right away?
Well, Penelope, Oscar has definitely progressed enough to be discharged from the hospital, but I agree with your concerns that your husband is not able to go home just yet. We did x-rays when he first came in the day of the accident, and things were very malaligned, so we realigned and casted him. Plan to x-ray him in a couple of weeks to check his progress, but after the realignment and casting, I believe things will heal quite nicely. His CT scans showed that there was no brain damage, and he has been very alert and conscious since the day of the accident. I did change his hypertension medication from the verapamil to Lasix to help get his hypertension under control a little better, and we have seen a decrease in his blood pressure since. Megan, what have his daily encounters been like?
Well, when he first came in, his blood pressure was rather high at 168/96. His heart rate was 110 beats per minute, and his respiratory rate was 22 beats per minute. His pulse ox was rather low at 90%, and his blood sugar was rather low as well at 66, which I figured I would also check his pulses and found that those were also pretty faint. After sedation, though, all of his levels seemed to return to normal. Over the past few days that he was in this hospital, I checked his lungs to make sure he didn't develop pneumonia, or I also checked his skin to make sure he didn't develop any bed sores, since he does have diabetes, and that does lead to increased risk of those. Overall, he's being very well monitored, and everything seems to be going very well. I noticed with the PTs and the OTs that they seem to be doing well with the bed mobility and transfers and things, so I will go to them next, and you can kind of talk to them.
Alright, well the toes and the fingers that I've noticed have looked properly perfused, so his casts don't appear to be too tight. However, I did notice his pain medications are causing him to be a little lethargic and hard to get involved in treatment, so that might need adjusted.
He had been given Vicodin the past few days, one pill every 6 hours for the first 2 days, and then as needed the last 2. But I believe he can be transitioned off the Vicodin to acetaminophen as needed instead of the painkillers. That should help decrease fatigue so his PT is more effective.
Alright, mate, sounds great. I also did notice that his strength in his quads and his hamstrings are diminished due in the involved lower extremity, so that does influence his mobility a little bit. He is also having some muscular soreness due to the injury, so the strength in his upper extremities has a little bit of inconsistencies when I'm testing them. However, there is diminished strength noticed in the involved upper extremity. And he's unable to reach that full shoulder elevation, but it's believed to be due to soreness, not necessarily the injury. He is using a platform walker, not crutches currently, due to his wrist fracture, and that's helping him ambulate, and his speed is a little decreased due to pain. He was educated properly on how to use them, and stair ambulation is still quite difficult due to the weakness and the fact that he does need a lot of assistance whenever we're using the stairs. And his transfers also, they are min-assist currently, so he does need a little bit of assistance due to his injuries and the inability to use that involved upper extremity, so he cannot do them by himself currently. And I personally don't believe he's ready to return home to the second floor of his house due to not being able to have much assistance and being able to move around quite as well as we would like him to. OT, what have you got?
Yes. Well, Oscar's just the sweetest patient to work with. He's just been awfully well in therapy lately. So he still requires men assist with ADL, so brushing his teeth and hair, applying deodorant. At mealtime, OT is still cutting food and dealing with meal setup. We're using adaptive equipment for eating because his right wrist is obviously fractured. And then as far as bathing and in the bathroom, he's using a men assist getting to the bathroom. And then in the shower, he's using shower chair because he cannot reach posteriorly or stand on his own 2 feet due to the ankle fracture. So I think we should try to look ahead into the future, maybe at some point, and consider installing grab rails and a shower chair in his home once he returns there in the future.
All right, so Penelope, do you have any other concerns?
Yes, I'm just concerned. I really want to make sure he's getting the proper nutrition he needs because he does have the diabetes.
I can answer that for you. My main concern obviously is keeping his blood sugar levels in check. Since Oscar has been in the hospital, his levels have remained relatively normal. We've been having him put on a low-fat, low-sodium diet, and we've been increasing his fibers through whole grain cereals, breads, and pastas. I would advise no soda or juice, just water. This will help keep his blood sugar levels lower, and also Oscar's very overweight. So we would need to help him lose some weight. That will help be able to control the diabetes better. But that can be discussed further down the road when he's returning home. As for now, this diet will be continued wherever Oscar's transferred to next, and I will be making a meal plan for you and to send home with you when Oscar goes home. So you won't have to worry about that.
Okay, that sounds perfect. Thank you. I also have one more thing. I've noticed that he's feeling very depressed lately. Is there anything that I should do or that you guys can do for him for that?
Well, that's a good observation, Penelope. Often people do get depressed when they feel dependent on others. There are a few things we can do to help him out with that. I think it would be a good idea for us to meet, and I could do a depression screening on him. And I could help you after he's done with his physical therapy and he's going home. I could help you find a gym or a wellness program that you could go to together, help him get in shape after he's healed. And we can figure out some more details whenever we meet with Oscar. How does that sound to you, Penelope?
That sounds great. We always wanted to get an exercise program together.
All right, sounds good. I think that's the end of our meeting, y'all. I think we decided that the best thing for him right now would be to go to a rehab facility because he's not ready to go home. So anybody else have anything? All right, thank you for coming.
Thank you.
It was very nice to meet you.
Pleasure to meet you.